Troopers say 84-year-old Lois Phillips drove the wrong way for about a mile.
Okay, were you feeling confused or something?
I didn't think so. I think I may have been going the wrong way. I'm not sure.
Motor vehicle crashes are responsible for thousands of deaths and millions of injuries each year. In addition to drivers impaired by alcohol or drugs, and those impaired by distractions such as the use of cell phones and texting while driving, medically impaired drivers are becoming an increasing public health concern.
Your expertise in a program you've developed, I think, is so important, and it relates to driving among older adults and dementia, the onset of dementia. Describe your program briefly for us.
Thanks, Greg, and again, thank you for your interest in this area. We know that the incidence, the number of new cases of dementia, and the overall prevalence of dementia is going to increase significantly in the next 2 to 3 decades. And that's due in large part to the aging of the baby boomers, my cohort. Having said that, we know that in the United States, for example, there's about 13.5% of the population 65 and older that has dementia. In Canada, it's about 11%. A significant percentage of that population is driving. And we know that with a illness such as progressive dementia, Alzheimer's disease, it's not will driving become impaired, it's when will driving become impaired. One of the really important considerations in terms of driving and dementia is to not make decisions about licensing or retention of the licensing on diagnosis alone. In that if you look at the data, about 2/3 of individuals in the early stages of dementia are unsafe to drive, but 1/3 are still safe to drive. So if we revoke licenses based on diagnosis alone, we're unfairly penalizing that third.
It's not a clean-cut issue like that.